Good afternoon, good morning, good evening. Dr. Mandela here with you. We are broadcasting live via YouTube right now, streaming, and we are going to talk about pinched nerve release in the neck area. This is a great stretch, but before I go right into it, I'll move through it real quick. I promise you, I'll try to do my best to get the message across, but this is about reducing contraction in those SCM muscles, those scalenus muscles, the upper trap muscles. This is a fantastic stretch, so I'm going to get right to it, and I'll demonstrate it in just a minute or two. Okay, so we're going to go to our first thing called the SCM muscle. Quick review, just to showing you the sternocleidomastoid muscle. These are the muscles that actually turn your head over to the side. When they both contract, it brings your head forward. But generally, that's that big muscle. When I turn my head like that, you can see that big muscle sticking out. That's one of the key muscles with neck pain. All right, here's another SCM, as you can just see exactly where it's located. Here is another SCM, just to give you the idea. It attaches to the mastoid process, goes down to the sternum as well as the clavicle, the two different insertions. These are common SCM trigger points. In other words, when these muscles contract, what does it do? Wryneck, torticollis, pulls the head straight over. If you're sleeping on a poor pillow, low pillow, high pillow, not sleeping in the right position, guess what? You may wake up with wryneck, headaches, neck pain, radiation of pain. Look where the referred pain, when these muscles contract, pain in the face, behind the head, on top of the head, into the chest. Okay, so I don't want you to deceive pain and say, okay, here's my problem. No, your problem's probably somewhere else in those SCMs. One of the next things that we're going to mention, I'll come back to this in a minute, is a trap muscle. The trap muscle, extremely strong muscle with forward head posture, rounded shoulders. We spend a lot of time in this position. Those trap muscles are stretched as the weight of the head being 12 pounds is pulling forward, and those muscles are weakening back in here. We'll come back to that in just a minute. Now, the next important thing, this is very important, are called the scalenus muscles. If you notice here, the scalenus muscles, as well as the SCM or the sternocleidomastoid muscles, are the muscles primarily for lateral neck flexion. So why are we talking about the scalenus muscles here? Well, if we look here, thoracic outlet syndrome. When the anterior medial scalenus muscle shuts down and contracts, the neurovascular bundle, the group of nerves, which I'll show you in just a second, runs right through these muscles. So when these muscles contract, you then can get numbness, tingling, cramping, pain down the arm. This is a very significant problem as a result of forward head posture, rounded shoulders, and these nerves can be compressed and irritated. If I show you the next picture right here, this is the interscalenus groove. If you see between the middle and anterior scalenus muscles, if we look here, scalenus muscles, when these muscles deep inside of here, where that neurovascular bundle of nerve is coming through, when those muscles contract and clamp down, look at the symptoms of referred pain. If you look on top of the green little dots up there, if you look at the orange, those are all common areas into the chest, down the arm, inside the shoulder blade. Very, very common. So you go to the neurologist, the orthopedist, you take MRIs, they show you have a herniated disc. Guess what? In most cases, it's not always coming from those discs. It's coming from the trigger points affecting within the muscle. I need to explain it. I need to share it with you because I don't want people like you, beautiful people, that's going to get invasive procedures because you're getting radiation of pain. They're seeing a herniated disc and right away they want to operate on it. And that's why there's so many failures, incorrect diagnosis. So we know what a pinched nerve is. There are many ways a nerve can become pinched and irritated. When a nerve is pinched, kind of think about it like you're watering a garden. The energy of the brain's trying to send messages down the spine, out the nerve to what it's controlling. Every part of your body, every cell, tissue, organ, and gland is being generated by nerve energy coming from the spine, making its way back up to the brain. When there's lack of communication from the brain to the tissue cell, that area is kind of like you stepping on a garden hose, trying to water a garden. The garden's not getting its water. Well, these cells are not getting its nerve energy. And that's why we have symptoms of pain, discomfort, and that's what actually happens. So, and lastly here, the brachial plexus. Brachial plexus is a group of nerves that come out that makes its way from the brachial region down into the arm, into the hand, into the fingers. People complain of tingling, numbness, and the pain can actually move into the chest, between the shoulder blades. It can be quite complex. Now let's go back to why you are here, because you want to learn this little technique, and I'm going to show it to you because I like it and I love it. We go back to the traps. What we're going to do is we're going to take the trap area. For example, if my problem is on the right side of my neck, I want to stabilize that right trap. Okay, so I got to be a little creative here with you, so bear with me. I'm going to try to do it this way. Now I'll see if I can fit myself in here. Okay, give me a second. We're going to take a towel, and I'm going to move back a little bit. I'm going to try to get myself in the picture. I know that I'm not all blown up here because we are not on plain video, but what I want you to do, I take a long towel like this, and I want you to roll it up, okay? I'm going to come back a little bit like this, and I want you to roll it up, all right? So you're going to roll it up. Now, you can use like a belt or anything that's long and firm, but what we're going to do here is we're going to just bring it over the trap muscle like this, all right? Let me see if I can come down a little bit on the cam where maybe you can get me a little better here. But you're going to bring it over the trap muscle, and then what we're going to do, and I'm going to kind of make my way in the cam where I can see myself, we're going to take our hand and grab the back of that towel here. Now, if I turn around here, see what I'm doing here? I'm grabbing that towel. So we got it over the right trap, and I want it up on the trap. I don't want it down here. I want it up on the trap because we're going to hold on to that trap area, and we're going to grab it like across, kind of like we're like the Miss Beauty pageant. You know, we got that towel going across our chest like this, and I want you to take that other hand, which is your left hand, and pull it down to the left, kind of like you're the beauty pageant, okay? So what I want you to do now, I want you to pull down firmly like this. Now, when you pull down firmly, what I want you to do, I want you to lean your head to the left side. Go ahead. You're going to say, wow, I've never felt a stretch like that before. Now, what you're doing here is you're stretching these scalenus muscles. You're stretching the sternocleidomastoid, the SCM muscle. And as you just hold it over, as you're pulling down firmly, you are really opening and elongating that muscle. That is a great, great stretch. Now, you could also take the head and lean it a little forward, okay? And you'll get a little bit of the posterior scalenus. Now, the purpose of doing this is that you want to release that scalenus muscle. You want to release the SCM muscle, because by doing that, you're going to actually help potentially your thoracic outlet syndrome, the contracture of the scalenus muscle, which is a contracting on that neurovascular bundle. Okay. Now, not only that, it can reduce irritation off nerves, will free up mobility. It can actually break down adhesions and scar tissue, because if you're having chronic neck problems, something's limiting you. And the thing is, it's kind of like if you don't get the motion, you'll never have it. But once you get it, you'll always keep it. So that's why it's important that a lot of these conditions of neck pain are directly tied into adhesions. You can see many of my videos, and I'll explain that in different videos over and over again, but that is a very important stretch, and I hope you make use of that. It's a very simple stretch, but hold that and then just kind of lean over, feel that burning, don't overdo it, and as time goes on, you'll be able to go further and further and further. Then you can bring it a little bit further forward. You will feel it immediately like no other stretch. Okay, I know I've done hundreds of self-help videos, but this one's a great one. I have yet to do this one, and it's quite exciting because I know it will help you. So anyways, I ask you to subscribe to my channel here if you haven't. I want to thank our chatters for being in the chat room. I really hope you put this to good use. It's a great stretch. It's a simple stretch. It doesn't cost you any money, just a towel, a belt, something that's firm and tight that you can actually stabilize that upper trap. Hold it on the trap. Don't bring it down on the shoulder. Stabilize the trap, and everything else will release. Check out my channel, Motivational Doc, on Facebook. But most important, I really hope that everyone has a blessed day, good health to you and your family. And I appreciate our chatters in the chat room very much. Much love to all of you, and we'll be back with you real soon. Bye-bye now.